Osteitis deformans, better known today as Paget disease. This is a chronic bone disorder that typically results in enlarged, deformed bones due to excessive breakdown and formation of bone tissue that can cause bones to weaken and may result in bone pain, arthritis, bony deformities and fractures. The disease is named for an English surgeon, Sir James Paget (1814–1899). Paget disease is rarely diagnosed in people under 40. Men and women are affected equally. Because Paget disease may be familial, after age 40, brothers, sisters and children of someone with Paget disease may wish to have an alkaline phosphatase blood test every 2 or 3 years to screen for Paget disease. Many people do not know they have Paget disease because they have a mild case of the disease with no symptoms. Sometimes, symptoms may be confused with those of arthritis or other disorders. The symptoms of Paget disease can include bone pain, the most common symptom. Bone pain can occur in any bone affected by Paget's disease. It often localizes to areas adjacent to the joints. Headaches and hearing loss may occur when Paget's disease affects the skull. Pressure on nerves may occur when Paget's disease affects the skull or spine. Increased head size, bowing of limb, or curvature of spine may occur in advanced cases. Hip pain may occur when Paget's disease affects the pelvis or thigh bone. Damage to cartilage of joints may lead to arthritis. Paget disease may be diagnosed using one or more of the following tests. X-rays. Pagetic bone has a characteristic appearance on X-rays. Alkaline phosphatase test. An elevated level of alkaline phosphatase in the blood can be suggestive of Paget disease. Bone scan. Useful in determining the extent and activity of the condition. If a bone scan suggests Paget disease, the affected bone or bones should be X-rayed to confirm the diagnosis. The outlook with Paget disease is generally good, particularly if treatment is given before major changes have occurred in the affected bones. Paget disease occurs most frequently in the spine, skull, pelvis, thighs, and lower legs. In general, symptoms progress slowly, and the disease does not spread to normal bones. Treatment can control Paget disease and lessen symptoms but is not a cure. Paget's disease may lead to other medical conditions, including arthritis. Long bones in the leg may bow, distorting alignment and increasing pressure on nearby joints. In addition, Pagetic bone may enlarge, causing joint surfaces to undergo excessive wear and tear. In these cases, pain may be due to a combination of Paget disease and osteoarthritis. Hearing. Loss of hearing in one or both ears may occur when Paget disease affects the skull and the bone that surrounds the inner ear. Treating the Paget disease may slow or stop hearing loss. Hearing aids may also help. Heart disease. In severe Paget disease, the heart works harder to pump blood to affected bones. This usually does not result in heart failure except in some people who also have hardening of the arteries. Kidney stones. Kidney stones are somewhat more common in patients with Paget disease. Nervous system. Pagetic bone can cause pressure on the brain, spinal cord, or nerves, and reduced blood flow to the brain and spinal cord. Sarcoma. Rarely, Paget disease is associated with the development of osteosarcoma, a malignant tumor of bone. When there is a sudden onset or worsening of pain, sarcoma should be considered. Teeth. When Paget disease affects the facial bones, the teeth may become loose. Disturbance in chewing may occur. Vision. Rarely, when the skull is involved, the nerves to the eye may be affected, causing some loss of vision.